22 million Americans expected to be impacted by this lapse in subsidies. What will this mean for them?
Well, you know, Ariel, sticker shock is real for millions of Americans across the country right now. Many of them were re-enrolled in the program that they already chose prior to, but now they're dealing with much higher premiums. KFF estimates about 114% of an increase for those annual premiums this year compared to last year. And it's only going to increase with the current state right now. Now, I want to walk you through who is going to be impacted by this the most, according to research by Urban Institute, which is a nonpartisan research organization. Young people are going to really feel the effects of this. And this is really gets really interesting. Without those enhanced tax credits, about 4.8 million more people will actually drop their coverage in 2026. That's an increase in the uninsured population of about 21%. Now, among racial groups, Black non-Hispanic people are projected to see the largest increase in uninsurance rates, while white non-Hispanic people are following closely behind on that with 25%. And as you can see there's 8 different states across the country that are going to really feel the brunt of this. You have Georgia, Louisiana, Mississippi, Oregon, South Carolina. And, you know, these uninsured rates are only expected to grow. At this point, Congress could come together and try to make a deal, but that doesn't mean that those who are the most vulnerable are going to feel that change in their pockets, and that's where the real concern is right now. I spoke to several of them who really feel like they're neglected at this point.
What we're looking at for us as a family of 4 is if our income goes over $125,000 a year, our insurance is going to go up about $20,000 a year for a bronze ACA plan. It means a lot for my family. It means how much we can spend on my daughter's college. It means things we can do with my son. You know, will we make it? Yeah, we'll make it through, but it's certainly wasn't something we were expecting.
And I think in the past, many of these enrollees were really grappling with the idea of rolling the dice. Do they enroll in health insurance, which is going to be extremely expensive, or not? But for many individuals, they don't have that choice. And what you're seeing is that many of the younger population will choose to potentially not have insurance because they might not have as many health issues as those who are in the older population. But those who are in the older population are really concerned right now because they can't go without health care. They want to make sure that they are covered as much as possible. And when those prices are so high, they are drawing from their savings accounts, from their retirement accounts, and it's going to be very tight this 2026.
Definitely. So, of course, we're talking about the real impacts on real Americans. You see there the heartbreaking choices some Americans are having to make there, Annalise. What kind of political blowback do you think Republicans are going to face for standing in the way and letting these subsidies lapse?
Yeah, well, I'll quickly disclose that this is an issue I work on as part of my day job. But, you know, as far as it goes, as with Republicans, I mean, this is really something that they should have addressed at the end of last year. And I thought that it was really remarkable that you saw 4 Republicans sort of cross Speaker Johnson and jump onto that discharge petition, which is, of course, a way to get around regular order and try to move something when the leadership is not doing it. So I thought that was a really interesting signal. And that I do think there is some hope that this gets addressed in January. But what a lot of these Republicans are seeing in these swing districts that are going to have a tough battle in the midterm elections are kind of a bit of a replay of what happened in 2018 with that cycle. There was a big blue wave. If you remember, I was in Michigan working on a race for a Republican who lost, and he lost because of the pre-existing condition challenge. So I think Democrats are seeing that. They're realizing that they can sort of rerun that play. The American people tend to trust Democrats when it comes to healthcare, Republicans when it comes to the economy. So I think if the economy is not bouncing back quickly in the way that it needs to, and Democrats are successful in prosecuting that Republicans are not here to make sure that their healthcare costs are affordable, then that is a challenging combination for Republicans in the midterms.
It would be a challenging convergence of those two dynamics. What can and should Republicans do, and how urgently do they need to act in order to save themselves for the midterms?
Yeah, well, I mean, the urgency has come and gone. Yeah, I mean, there are a couple of weeks here. Remember that there is a government funding deadline at the end of the month in January now. Yes. So there is another bit of an inflection point for members to come together. This discharge petition, which is a 3-year extension of the subsidies that's moving on the House, it's already failed in the Senate. So I don't really see that going anywhere specifically. But I think there are a lot of people, you've seen so many different folks Republicans and Democrats who've put forward an idea. And I think that gets to the point that there are a lot of people who want to solve it. The challenge is that leadership has really got to come in and put something on the floor and let folks vote on it.
Yeah, getting people to coalesce around something is different than just having a bunch of proposals that nobody's connecting to. Julie, Democrats set these subsidies to expire in the first place. Now Republicans are blocking the extension, of course. That's a dynamic we find ourselves in. Without the majority for the Democrats, is there anything they can do to harness the moment to get something done for the American people? Forget the politics. How do they extend these ACA subsidies so that premiums don't soar?
Get in the majority next year and make it happen. I mean, that's really the only thing practically that Democrats can do. That's the reality. Look, you've got a third of MAGA voters, self-identified MAGA voters, who said that they will blame Donald Trump and the Republicans in Congress if these subsidies are not extended. That is an astounding number for MAGA, not Republicans, but MAGA identified voters specifically. And what that leads to is, are they going to vote Democrat? Probably not. Are they going to stay home because they can't afford the price of their health care, their insulin drugs, their cholesterol drugs, their cancer screenings? Yes, they will. And so that's a big problem for Republicans. And for the life of me, I don't understand from a purely political standpoint, never mind policy, why they're doing this. I understand that Obamacare is the boogeyman. It's a curse word in the Republican Party. I understand that for the last, several decades almost, they've been complaining about Obamacare without finding a solution. But the reality is the rhetoric is cheap. Premiums are not. And what's going to happen is that when those premiums rise, ultimately, that's going to fall on their voters. Look at the list that was just read out loud. Except for Oregon, these are all red states who are most going to be impacted. I mean, they're really shooting their own voters in the foot, if not the head at this point. And from a political standpoint, it is just malpractice. So to answer your question, again, there is absolutely nothing Democrats can do other than remind people who's responsible for this. Democrats shut the government down to extend this, and it didn't work.
Right, it didn't work. So to that end, Ariel, I know you're out talking to Americans about how they feel about this lapse in subsidies. So who are they saying the blame rests with?
Well, the majority of them are saying they're just tired of having their health care be a real political talking point. They feel as if the idea that these are real people with real lives that are at stake is completely getting lost on Congress. And that's why the majority of them on both sides of the aisle are really pointing the finger at Congress in general. They don't understand how they have had this much time to come up with some type of deal, and that has not happened. And now they're feeling the strain on their pockets. And that's where a lot of worry and faith in the system that we have in place is starting to kind of falter. And that's why so many of them as well are talking about midterms. So many say that with this current situation, they expect to really voice their opinion in the polls.
Yeah. I really want to crystallize for just a moment here. I thought we were going for the soundbite. Sorry about that. Okay, so I really want to crystallize here the fact, what Julie mentioned, Annalise, which is according to KFF data, more than 3 in 4 ACA marketplace enrollees live in states won by President Trump in 2024. I know you kind of alluded to that as well. Among that 22 million who are going to see their subsidies expire are a lot of Trump voters. So what does this mean for Republicans? What does it mean for Trump's own base as we move forward towards the midterms?
A lot of people are really concerned with the fact that it's hard for Republicans to come and win, and when Trump's not on the ballot. I mean, there is this MAGA coalition that really only comes out and votes for Trump. So I think that's one of the dynamics that you see when Republicans are challenged to come and win elections when Trump's not on the ballot. But again, he's not going to be on the ballot again. This is the last time. So there are a lot of Republicans in Congress who are looking at that, and they're having to do this sort of balancing act where they're saying, we need those MAGA voters to come out, but we also have to win re-elections after Trump. It's know, he
It's a
really
fine balance. Yeah.
It is. I mean, I think a lot of people don't, are not quite ready, but he's going to be a lame duck very soon. And so there is sort of the smaller battleground of Republicans in particular in the House that are looking at that and appreciate that they're going to have to be elected after Trump. And that's why some of them are fighting so hard to get this done now, because they see that. But this battleground is a lot smaller. In 2018, as I mentioned, Republicans lost about 40 seats. There is a much smaller battlefield of seats that are being fought over in the House. So those are just not the loudest voices right now in Congress. Though they are trying to get something done, they're not the majority. They're, 15 to 20 people.
All right. So we do have that soundbite. I want to get to it because I think it's so important that we actually hear from Americans about how this impacts them. Let's listen.
That's my greatest frustration with what we're seeing with this ACA issue is we literally gave a multi-trillion-dollar tax cut to one group and have totally burdened the working middle class to be responsible for this. And in my eyes, the practical thing to pay off our national debt would have been to not have given that tax cut. And maybe we all did pay a little more like we are right now.
Americans are very dialed into this, even at the most technical level. Julie, House Minority Leader Hakeem Jeffries has repeatedly called on Republicans to return to Washington to vote on extending these ACA tax credits. Of course, that has not happened at this point, but he did also express a little bit of optimism that it could happen in the new year. Do you share any of that optimism?
I don't, because I think Republicans, as I said earlier, are just so committed and rhetorically, ideologically, and every other way to hating Obamacare. If we called it Trump care, it would probably pass tomorrow. And I'm all for saying, why don't we just call it Trump care and expand these subsidies? I mean, if that's what it takes, let's just get it done so that the American people actually have some relief. There are 22 million Americans who don't care that it's called Obamacare or the Affordable Care Act. They just want their subsidies extended. But the problem here is that this Congress has been captured by ideologues. It's been captured by MAGA Trump supporters who don't necessarily care about their own constituents. They do care about currying favor with Donald Trump. And Donald Trump hates anything that Joe Biden and Barack Obama did. Joe Biden is the one that extended these subsidies in 2021. But of course, Obamacare is named after Barack Obama. So for that reason alone, that's why we're seeing what we're seeing. We're living in some strange, bizarre world where somebody who is so obsessed politically with his predecessors is actually harming his own voters because these are policies that were created under his two Democratic predecessors. It's really remarkable when you think about it.